So those ingredients you need to avoid if you're pregnant, because they have been found to cause birth defects to your unborn baby. Hey guys, and welcome back to my channel. So today we're going to be discussing ingredients that are generally safe to use when you're pregnant. I have done a research because I was recently pregnant, so I know what we are not supposed to use and what to use to fight pigmentation when you're pregnant and other skin concerns. Right, so as we all know, when you're pregnant, your skin goes through a lot. You probably have hyperpigmentation, you may have acne, you may have melasma, you may have just skin sensitivity that you didn't have before you were pregnant. So there are products that you need to avoid to deal with that pigmentation or acne or whatever you're going through. The first ingredient that I'm going to talk about is retinoids. So retinoids are vitamin A derivatives. Examples of retinoids are tretinoin, that is a cream that you get over the counter. There is isotretinoin, which is called Accutane by some medical professionals. So those ingredients you need to avoid if you're pregnant, because they have been found to cause birth defects to your unborn baby. So you need to make sure you avoid anything with that ingredient, anything with retinol, whether it is topical retinol, whether it is the retinol that you ingest. You need to avoid it just to make sure that your baby is safe during those 9 months. The next ingredient is salicylic acid. So salicylic acid is mostly used in percentages of 2%, maybe in face washes, in serums. So anything that is salicylic acid of 2% and below is considered to be safe in pregnancy. But as long as it's more than 2%, it is generally not recommended to use when you're pregnant. The other ingredient that I'm going to talk about is hydroquinone. So hydroquinone is one of the most effective ingredients when it comes to clearing pigmentation, brightening your skin, or lightening your skin. So because of that, it is found in most of those lightening products that we find over the counter, in tuck shops, in wherever, in boutiques, those ones that brighten or lighten skin. So please do avoid skincare products that contain hydroquinone or anything that you don't know what it contains inside, but then you're just told that it's going to brighten your skin or it's going to fight your pigmentation. If you do not know what it contains, it probably has hydroquinone, so you need to avoid it during the course of your pregnancy. Now, the reason we avoid hydroquinone is that it travels very fast to your bloodstream, and anything in your bloodstream can go directly to your fetus. So you are encouraged to use it after pregnancy so that your baby is safe. The other ingredient that is very good for pigmentation is alpha-arbutin, but then alpha-arbutin later on, when you apply it or when you use it, it converts to hydroquinone, and that's how it fights pigmentation. So because it converts to hydroquinone, it is not recommended to use during pregnancy as well, for the same reasons that I mentioned before on the hydroquinone. So generally avoid anything that is retinol, alpha-arbutin, hydroquinone, salicylic acid in high doses. Just avoid it for the course of your pregnancy, because some of these products have been researched and found to cause birth defects. So you would rather suffer from acne, pigmentation, or whatever for the 9 months and then treat them after pregnancy than for you to have a baby with defects just because you wanted glowing skin, right? The next set of ingredients that I'm going to talk about are recommended during pregnancy. They are said to be safe to use during pregnancy. The first one is vitamin C. So vitamin C is brightening, it's an antioxidant, so you can use it during pregnancy if you want to fight pigmentation. If you feel that you need to stay glowing during the 9 months, you can choose vitamin C. Hyaluronic acid is also safe because it is just a moisturizer, it's just hydrating. Niacinamide is also been found to be not harmful to you or to your unborn child. Then benzoyl peroxide, it is also recommended to be safe to use during pregnancy. So if you're suffering from acne, then you can then resort to using benzoyl peroxide than using salicylic acid in high doses, because benzoyl peroxide is generally safe to use. So I'm going to tell you a skincare routine that you can adopt when you are pregnant, which is very simple, which is safe for you and for your baby. So generally you can just get a cleanser, a simple cleanser without any active ingredients, like CeraVe foaming cleanser. That is generally safe because it is just a mild cleanser. It doesn't have anything much to it. Then you get a hydrating toner or hydrating mist. You can use niacinamide, hyaluronic acid serums. As I say, that they are generally safe for pregnancy. Use a moisturizer to make sure you just don't leave your skin to get dry, and then apply sunscreen. So you need to apply sunscreen because your skin is really sensitive at this point in time. It's sensitive to the sun, and already you're suffering from pigmentation due to hormonal imbalance caused by the pregnancy. So you need to make sure you use sunscreen at all times to prevent further pigmentation, right? And then I'm going to talk about body care tips. So usually you have stretch marks when you're pregnant. When your belly is growing, you have stretch marks, and to combat these stretch marks or to prevent them, you are encouraged to make sure that your belly or your skin is moisturized, very moisturized at every point in time, moisturized, and then you are hydrated inside. So drink your water and use those pregnancy creams, those pregnancy moisturizing stretch mark creams. Just find any that you can use and probably just mix it with a with a tissue oil, and make sure you apply it before your belly starts growing, because it is easier to prevent stretch marks than to clear them when they actually come out. Then when you're pregnant, usually sometimes your skin is dry. Just make sure you have a tissue oil, you have a good moisturizer that you use, so that you don't get dry, you don't get ashy. And you can also get a sunscreen for your whole body so that your skin is not really affected by the sun. And then exfoliation during pregnancy. You are usually very sensitive when you're pregnant. For example, for me, my skin was very sensitive, so I could not scrub my skin using a manual or those physical scrub exfoliants. So I had to wait it out. I just used my exfoliating gloves. That is how I exfoliated my skin. I did not use any scrub, because any scrub that I would use would make my skin very sensitive and irritated. So I didn't use any of that. So just make sure your skin is moisturized, a good moisturizer, a good tissue oil, and a good sunscreen, and make sure that your belly is moisturized at all times. I used to moisturize mine twice a day or thrice a day. Anytime that I feel like my belly is dry, I'll just apply that cream that I was using. I'm gonna insert it here. So in summary, I talked about anything vitamin A derivatives, retinol, retinoids, anything, whether you ingest it or whether you apply it topically. Avoid it when you're pregnant. Avoid salicylic acid in high doses. Avoid alpha arbutin. Avoid products with hydroquinone, because they may cause harm to your unborn child. So this is what I had for today. If you have any questions, if you have any suggestions, tell me or tell us what you used when you were pregnant, how you managed to fight pigmentation when you were pregnant, and even after you gave birth, because I'm still trying to fight the pigmentation that I got over the past 9 months. So yeah, thank you guys for watching, and if you've watched till this point, please do leave a comment, like, and subscribe. Thank you, and see you in the next video. Bye.